How is dementia diagnosed by healthcare professionals? Have you ever wondered how healthcare professionals figure out if someone has dementia? It's a complex process that involves several steps to ensure an accurate diagnosis. Dementia is a term that describes a decline in cognitive function, including memory loss and difficulties with communication and problem solving. To diagnose dementia, doctors take a comprehensive approach that includes various assessments and tests. First, healthcare professionals will gather a detailed medical history from the patient. This includes asking about previous illnesses or conditions that could be contributing to the symptoms. They will also perform a physical examination to identify any underlying health issues that might be affecting cognitive function. Next, cognitive and neurological evaluations are crucial for diagnosing dementia. These assessments evaluate memory, language skills, and problem-solving abilities. Common tools for these evaluations include the Mini Mental State Examination and the Montreal Cognitive Assessment. These tests help to pinpoint specific areas of cognitive decline. Laboratory tests also play a role in the diagnostic process. Blood tests are often conducted to rule out other conditions that could cause similar symptoms, like vitamin deficiencies or thyroid disorders. While these tests alone cannot diagnose dementia, they help eliminate other potential causes of cognitive decline. Imaging tests such as magnetic resonance imaging or computed tomography scans are used to look for structural changes in the brain. These changes can be associated with different types of dementia, including Alzheimer's disease or vascular dementia. In some cases, psychological evaluations are included to identify any mental health issues that could be contributing to the symptoms. There are also advanced diagnostic techniques available. For instance, amyloid positron emission tomography imaging can detect amyloid plaques in the brain, which are linked to Alzheimer's disease. This method is more expensive and less accessible than other imaging techniques. Cerebrospinal fluid testing can measure proteins associated with Alzheimer's disease, but it is more invasive and typically used when other methods are inconclusive. Recent advancements have led to the development of blood tests that can detect specific biomarkers related to Alzheimer's disease. These tests are less invasive and may be more cost-effective than traditional methods. Early diagnosis of dementia is important for many reasons. It allows healthcare providers to create a treatment plan aimed at managing symptoms and slowing disease progression. It also helps patients and their families make informed decisions about long-term care and lifestyle changes. Additionally, early diagnosis aids in planning for future care needs and financial arrangements. In summary, diagnosing dementia involves a combination of clinical evaluations, laboratory tests, and imaging studies. While there is no single definitive test for dementia, a thorough diagnostic approach helps healthcare professionals accurately identify the condition and develop appropriate management strategies. If you or someone you know is experiencing symptoms, it is essential to consult a healthcare professional for a proper evaluation.